The treatment for ADHD has three important components, and they have to be used usually at the same time. The first part, through behavioral modification techniques with the psychologists or social worker therapists, they need to know how to handle different behavioral situations and how to make the best of every situation. The second part of the treatment is what is called academic intervention, and it involves an assessment and also adaptations and accommodations, depending on the difficulties and also the skills of the child. And the third part of the treatment, the use of medicines that help to increase the dopamine in the brain, which is the messenger that they lack. The medicines that are helpful in ADHD are very safe and effective, and they've been known for a long time. And they're basically of two types, the stimulants and the non-stimulants. Now, on the stimulants, sometimes it's confusing to parents because you have a child that is very hyperactive and you give them a stimulant, they think they're going to get more activated. But what you're actually stimulating is the frontal part of the brain, which is underworking or underperforming in these kids, and that works like a brake. So you're activating a brake that is going to reduce the impulsivity, reduce the hyperactivity, and increase the focus. The non-stimulants are working on the back part of the brain, eventually is connected to the frontal part. So they do the same thing, but the difference is that they take a little longer to work. Usually the stimulants are used first, and if they don't work, you can use the non-stimulants. First of all, the stimulants are very safe and they're very easy to use, but you have to have training in order to do that. So you have to go to a specialist. And the most frequent side effects are mild. There are things like decreased appetite. Sometimes you get a decrease in weight. And other very frequent thing that happens is that the kids take a little longer to fall asleep. So mild to moderate insomnia. But they're usually very safe. If the child doesn't tolerate the medicines and you stop the medicine, the side effects go away very fast. Parents should seek help for possible ADHD on any child that is having academic difficulties, any problems at school, usually like learning difficulties in preschool or early in school age. They should be checked for possible ADHD. Of course, they have to check other causes as well, learning disorder, many medical problems, etc. ADHD is real, is frequent, and is treatable, and is nobody's fault.